how to fix Canada's struggling healthcare systems. That has been much of the focus of debate for past years. It's also the question at the heart of a new report out today, authored by some of the country's leading experts. The report offers advice to both provincial and federal governments to fix systems in crisis. Dr. Jane Philpott is one of the authors of the report called Taking Back Healthcare. She is a former federal health minister and now the Dean of the Faculty of Health Sciences at Queen's University. Dr. Philpott, thank you so much for speaking with us today. I'm going to ask you about the report in just a moment, but I want to start with your take on some announcements by multiple provinces in recent weeks about expanding healthcare services in private facilities. Is this route that the provinces, is this what they need to take and need to do in order to deal with the crisis in care?
Well, thank you for asking, and you'll be interested in knowing that this report that came out today by the Public Policy Forum speaks very directly to that, talks about the fact that in a way, this public-private conversation can be a bit of a distraction, and there's a lot of myth busting that needs to happen in that, people often don't necessarily understand the intricacies about the fact that we already have systems that are very dependent on private delivery of care. In some cases, that's the only kind of care available for certain kinds of services. So there's already a lot of private delivery of care in the system. A couple of really important things to emphasize as the provinces are looking at this is just to always make sure that people have access to care based on their medical need and not based on their ability to pay. That's sort of the ground rule basic that we need to remember when we start talking about it's not private pay for care that they're talking about private delivery of care. And the other thing that the report speaks to a little bit is the fact that you can build new health facilities and they may be private delivery facilities. At the end of the day, though, our health system depends on the people in the system. So you might build new facilities, but if you don't actually have the nurses and doctors that are necessary, then you're not necessarily expanding the access to care.
The federal government is taking a sort of a step back, wait and see approach to see if perhaps what Ontario is expanding, what Alberta is expanding. We talked to the Premier of Nova Scotia. He's looking at ways to expand services offered in private facilities. Do you think that that is the right approach by the federal government to watch and see if this does lead to change, if this does create better care?
Well, the good news is that people are open to looking at all potential solutions, and this is one of the things that comes up all of the time. And so I do think that we can't put a damper on people's desire to innovate and make sure that we've actually got the best systems available. As I say, making sure that those ground rules are always kept in mind. I would say, though, that it's not where the most bang for our buck is in terms of actually improving health systems. So it's an easy place to turn our eyes. But in fact, this report that came out today talks about other things like, for example, access to primary care teams or a family doctor and an interdisciplinary team. That's where this report really recommends that the investments should be focused on making sure that people have access. Ideally, every Canadian should have access to a primary care team, just the way that every child in the country has access to public schools.
You say biggest bang for your buck. Lay it on us. Where is it? What do you think that is?
Well, the reality is that sometimes the most effective parts of our healthcare system are not necessarily the most expensive parts. And we actually spend a fair bit on healthcare per capita, but don't necessarily get outcomes that are as good as countries that spend less than that. And so looking at things like access to primary care so that people will go to be able to see a provider, it might be their family doctor, or it might be a nurse practitioner or a dietitian or a social worker. If they can get that kind of care in a timely way, it might mean that they can avoid a trip to the emergency department. It might mean that they can avoid further advanced disease, a heart attack or something like that. And so making sure that we're spending smartly is going to take an enormous amount of system reform. And that's where we who put this report together would really like to see policymakers and politicians putting a lot of their energy.
So if that's where they're putting their energy, is there something specific they can be doing? Is this, you talk about access to care in a timely way. Is that bringing in more staff or finding ways to get more frontline staff in? What does that tangibly look like?
Well, it tangibly looks like, if you have a chance to read the report, or your viewers do, I hope they will see the call for the fact that every Canadian should have access to a primary care team, ideally within 30 minutes of where they live or work. As I said, we've managed to figure out how to do that for public schools. There are 6 million Canadians right now who don't have access to a family doctor. And imagine if we had 6 million young people that didn't have access to public school. We would not tolerate that. So why do we tolerate the lack of access to primary care? This will require that political will, that energy amongst the federal government and all of the provincial and territorial counterparts to say, we're going to invest in these areas, and it's actually going to save money for Canadians in the long run, not to mention people getting better care.
You sort of mentioned this earlier in our conversation, but you have said that there has been this collective national myth that Canada has the best healthcare system in the world. How do you want Canadians to, do you think Canadians need to reframe how we think about healthcare?
Well, in fact, yes, we would like Canadians to do that. And, I think that our complacency has been lifted, I would say, in the process of this pandemic, is that, people were perhaps not aware of the fact that we have had fragile systems. And now that this assault of the pandemic has really opened up those cracks in the system, people have realized just how fragile the systems were. What this report calls for is saying, you know what, it's the health system for the people. It belongs to us all, and we ought to really elevate our expectations of the outcomes that we should get from all orders of government working together to say, we expect to be able to have that kind of access to care. We shouldn't have to wait weeks to get care. We shouldn't have to go to the emergency department to get care. And that's not the fault of primary care providers, but it's the way that those systems have been designed, and that there hasn't been that push, that effort to say, look, this is the expectation, that Canadians should be able to get that kind of care in a timely way.
My last question to you, it's kind of a depressing question, but do you think we're at the point where the systems in this country, in terms of care, and we've seen so many examples of things not going right, and we know about wait times, we know about deaths in Nova Scotia in emergency rooms or waiting for care. We've seen the examples. Anyone who's been through the system and has dealt with it lately knows just how difficult it is. Do you think we're at rock bottom right now in terms of where our healthcare system is functioning?
It's an interesting way to frame it. I would say we're not at rock bottom. We don't ever want to get to rock bottom. We are at a low that we haven't seen for a very long time in terms of those kinds of experiences. It's time to climb out of that low, to expect more from our systems, to make sure that they are highly functional, and that everybody works together, that our health workforce gets the support that they need, and that we design systems so that Canadians will be able to get on with their lives. Health is incredibly important to the success of our economy, but also, of course, to people's well-being. And it's never been more important than now to fix what's broken.
Dr. Philpott, thank you for your time.
Thanks for having me.